Bismillahirrahmanirrahim. In this video, the defects in leukocyte functions are summarized. The references for this video are these. So, defects in the leukocyte function will result in the prolonged process, and as there is prolonged process, there may be repeated infection and other conditions. One is the iatrogenic neutropenia that is induced by chemotherapy, and as there is depletion of the neutrophil, there is increased susceptibility to infection. Then there are defects in adherence of the leukocyte and immigration. So the conditions are leukocyte adhesion deficiency type 1 and 2, and in this condition there is defective integrin or selectin that prevent migration of the leukocyte to the site of injury. Then there is defect in chemotaxis, and one example is Shidiak-Higashi syndrome, in which there is defective microtubule function. This defective microtubule function will result in defective phagolysosome fusion. The defects in phagocytosis and killing. The example is chronic granulomatous disease, and it is the result of deficiency of NADPH oxidase. So no reactive oxygen species is produced, and this will lead to recurrent bacterial and fungal infection. Hyper IgE recurrent infection, that is CHOP syndrome, is through the STAT3 mutation, and in this there is impaired Th17 cell function, so impaired recruitment of the neutrophil that will lead to recurrent staphylococcal infection, eczema and skeletal abnormalities. So neutrophil has got many granules, so there can be specific granule deficiency that will result in particular protein production deficiency. So there can be absence of lactoferrin, defensin and other antimicrobial protein, and there will be increased susceptibility to infection. Myeloperoxidase gene mutation will result in myeloperoxidase deficiency that will result in reduced hypochlorous acid production that will impair microbial killing. This condition is often mild, but it results in repeated or increased risk of fungal infection. The acquired effects are diabetes mellitus, leukemia, malnutrition, sepsis, and viral infection, in which there is impaired leukocyte function due to metabolic dysregulation and immune suppression. Thank you for watching this video. If you have any question, please write in the comment box.